Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in our conversation with Cancer Expert series, we have Dr. Jeffrey Zonder with us. He's professor of medicine at Wayne State University, a leading figure in the plasma cell dyscrasia space, right from smoldering myeloma to multiple myeloma to even amyloidosis. So we're going to today talk, however, on smoldering myeloma, to treat or not to treat. Welcome, Jeff.
I thanks so much, Ravi. I really appreciate the invitation to come speak today. This is a complicated topic.
It is, and getting more complicated by the day, and more controversial by a little bit as well.
Let's tee up the talk by just discussing what smoldering multiple myeloma is.
Sure.
Remember that symptomatic myeloma always arises from a precursor stage, monoclonal gammopathy of uncertain significance, and by definition, MGUS has no symptoms and less than 10% bone marrow plasma cells. Once you cross that 10% threshold, or 3 grams of M protein, but we really focus on that 10% threshold. We start calling it multiple myeloma, and if there's no symptoms, still it's smoldering multiple myeloma. And as the bone marrow plasmacytosis keeps increasing northward of 10%, the likelihood of symptoms goes up. The likelihood of progressing to symptomatic myeloma after the initial diagnosis of smoldering myeloma is not the same for every patient. Here I'm showing you the traditional CRAB criteria that we think about for multiple myeloma that requires treatment, and the more updated SLIM CRAB criteria, which includes some other laboratory or imaging parameters for therapy requiring disease. But the important take-home point, I would say, is that the annual risk of progressing from smoldering myeloma to symptomatic treatment requiring myeloma is not the same. It can be as low as 5% for some patient subsets, or as high as 25% chance per year in others. We call that latter part high-risk smoldering myeloma.
So I guess the debate is to treat or not to treat, and I think most people, at the moment at least, don't even debate the low risk. It's really in the high risk smoldering myeloma that I guess this debate exists.
That's right.